Vertigo is a sensation that feels like the room is spinning, and Sanford Health physical therapist Jayme Watson helps her patients get through it.
For most of our patients, they might just wake up with sudden vertigo, so they roll and get out of bed in the morning and then feel like the room is spinning and whirling around them, to the point where sometimes they can't walk or stand or they're vomiting.
Vertigo can be caused by ear infections or head injuries, and Watson sees a wide range of ages, from 6-year-olds to 100-year-olds. She says women are more susceptible to experience vertigo along with other factors.
It's also more common for females to get them. People who have diabetes, migraines, vitamin D deficiency all increase that possibility.
Watson says the most common type of vertigo is BPPV, or benign proximal positional vertigo. That's when the crystals in our ears that help us balance are displaced, causing that feeling of spinning.
And the inner part of your ear controls your balance. So when they go out of place, you move your head a certain way, and then those crystals or those calcium deposits aren't in the correct position.
To fix BPPV, Watson has her patients lay on a table and she moves their head while looking in their eyes. She says when someone's crystals are out of place, that causes the patient's eyes to shake.
And I always tell patients, I know this sounds really weird, but you just kind of hold your head through a certain set of movements. And by holding your head through these movements, it allows those little crystals to float down that part of your ear and dump back to where it's supposed to be. So it's not really an exercise. We're just trying to mechanically put those little crystals back in place.
Watson says as people age, it's more likely for the crystals to displace more easily. Patients usually only need 1 or 2 visits to realign those crystals if they're out of place. But for serious head injuries, they could take up to 5 to 6 visits.
Those people might have those crystals out of place in right and left ear and in multiple parts of their ear. That increases the possibility that might be longer.
Watson brings up that if people don't get therapy to get their crystals realigned, some will have their crystals fix themselves and go back to normal. For others, their crystals could never realign.
I've seen patients that have had those crystals out of place for 20 or 30 years, and they've had that vertigo, and it's not till we specifically bring them through those movements to put them back in place to where they feel better. So if you come to therapy with that, you'd feel better sooner.